Yeah.
Okay.
Are we live?
I don't know. Yeah, I think so. I don't know. Yeah, we're live. Now we're live. Hi, everyone.
Hi.
We're going to watch this now and later. So me and Abby are going to talk you through treatments available at VL Aesthetics, and I will introduce myself to everyone as well. So would you like to say hi to everybody?
Hi, everyone in Carlisle. I'm not often here. I live in Leeds, actually, but
Yes.
hi to everyone here.
So what kind of things do you do here at the clinic?
At the clinic, so I basically see people for consultations, and then we send people to whichever department they need. So personally, I carry out things like injectables, like fillers, Botox, Profilo, mesotherapy, dermatology, skincare, facelifting with threads, or thread lifting, if you like, mesothreads. Lots of different things like that. Even, you know, I'm qualified in dentistry as well. So even things like complex facial reconstructions I've done. So there's a lot of experience there. So when you do things non-surgically, it becomes very easy. Yeah. And then I'll also treatment plan alongside things like that, even if I don't do them myself. Things like the lasers, radio frequency devices, body contouring, microneedling, dermal delivery, things like that. So because I'm qualified and everything, I can treatment plan everything together. So regardless of what people come in for, generally speaking, the best way to treat someone for any particular issue is to look at them in terms of which parts of their body, of their face, whatever, are affected. And they'll be different. For example, you've got the bone at the bottom and the skin at the top, and there's things in between. Everything in those layers is undergoing some sort of change, which has led to what the person has come in for. So each layer has to be treated in a different way. But in a place like this, the beauty is that because we've pretty much got everything, you can treat every single layer, every single different treatment if needed. Yeah. For example, if someone comes in with, you know, some sagginess in the face, if all the person knows how to do is inject filler, that's the only treatment plan they're ever going to get. But really, to do things like that, you might need to lift everything up, say something like along the lines of threads. You need to improve the skin quality with maybe with mesotherapy or microneedling or skincare, something like that. You might need to restructure everything underneath, provide a bit more support on the bone, filler, something like that. There's a lot of different things going on. So we do most, if not all, things that people need that come in here, barring full-on plastic surgery where people need a general anesthetic to be put to sleep. Barring that, we've got pretty much every base covered.
Yeah, and we can obviously direct you if, for example, surgery is an option. We also can direct direction should we feel that would be beneficial for you.
Exactly, yeah. In my training, I've come across a lot of plastic surgeons and things like that. I've worked in, I've been in maxillofacial departments in hospitals that do, you know, as I said, complex facial reconstruction and things like that. So if that's something that is an option, and generally what people come in for, there's usually a non-surgical way of doing it and a surgical way. We'll give you all the options, and if you do choose a surgical way, we can maybe give you a rough idea of the price, where to go, who to see, maybe even put you in touch with the right people if that's needed as well.
But like you said, it's really, really important to look at the overall approach, especially if someone's coming in with loss of volume, loss of elasticity. It's not just one treatment option. It's a combination of different tools that somebody would need in order to fix and address that problem.
Definitely, yeah. So when people come in for things like sagging skin, maybe in the jowls or folds from nose to mouth or mouth to chin, things like that, generally speaking, it's a combination of factors that cause it. So there needs to be a combination of things to treat it as well. One major factor is gravity. So there's nothing anyone can do to stop that unless you spend your life upside down or something like that. Yeah. But then, you know, you can lift tissues with, say, threads or something like that. But when someone looks at your face, even if the tissue's in the right place, if your skin looks old, you're going to look old. Yeah. So the ideal treatment would be something like repositioning tissues, for example, with threads to pull everything up, but then also some kind of treatment or combination of treatments to also improve the actual skin quality at the same time. Now, it's a good treatment that you mentioned there, sagging skin, because it's quite common and a lot of people suffer with it for obvious reasons. Now, as I said before, if all someone knows how to do is to inject filler or Botox, they're going to try and treat saggy skin with filler by saying to people, oh, you know, things come down, so we've got to start injecting up here to pull everything up. To an extent, that's acceptable because you may lose some bone around the cheek area, which, you know, imagine this is like a pair of trousers and that's the hanger up there. The hanger goes down, the trousers are going to be lower down as well. So there's a certain extent, yes, you can put a filler higher up in the face to pull things up, but the amount of filler you need to put in the side to lift the entire lower face, your face is going to be out here, and that's when people start to look ridiculous.
Yeah.
So filler, really, I think for me personally, my philosophy is to use it to regain some structure, regain a bit of symmetry, regain, you know, the proportion of the face. But it's not a lifting tool; it's just a volumizing tool.
Yeah.
So you can do that to some extent if they have lost some volume here, but it's not a lifting tool. I would combine that with something like a thread to pull up, or even refer to a plastic surgeon to do a full-on facelift as well.
Yeah, something that's going to as well stimulate collagen production is
yeah, definitely. I mean, the one thing that we always look at when people come in here is they always say, you know, I want this line gone or I want this wrinkle gone. Fine, there are many options to do that instantly. As an example, let's pick Botox. But at the end of the day, we also want to make sure that people are happy in the long term too. Now, you keep doing Botox again and again, it's not going to be great for you. I mean, you look at people that have constantly had it, their skin is not brilliant, you know, unless they've had other things done to it. It's going to thin the skin, it's going to vary the oil production, the skin can't adapt to its environment. So, you know, we will give you the short-term treatment option, but at the same time, we want to make sure something lasts for a very long time, years and years, not 3 months. So Botox is one option, but, you know, if we can use things like microneedling, mesotherapy, vampire facials, etc., they will give you that short-term result that you're after, where you're coming in for the removal of a line. But at the same time, it will also help against the aging process as you age. Because as you age and your skin gets thinner, Botox just makes that even worse. If you use something that makes the skin stronger over time, in a sense, you're kind of reversing the aging process.
Yeah.
So you're better off long-term to use things like that. And we'll give you both options here.
Yeah. But it's important to look at the long-term goal, not just short-term, because what's going to necessarily happen is when you get hit at 60, you're going to need to do more corrective types of procedures. Whereas if you tackle that like 30 onwards, you reduce the need to do that later on.
Definitely. I mean, a lot of people do talk about preventive work, and they talk about starting Botox early. But you look at those people, actually, you forget these phrases that you hear on TV. You just look at the people that did start Botox early. Quite frankly, their skin isn't brilliant. Yeah. And it's because they had so much and then started so early. So, yes, starting early is great. But, you know, starting early with something that thins the skin and weakens the muscle is the opposite of what you want to do. Starting early with sun protection, starting early with collagen production, starting early with maintaining volume, things like that. Those are the preventive things. Starting early with things that weaken the muscle, it's not a good idea. I mean, the muscle, for example, the forehead, that's the only thing keeping the skin up. If you weaken that muscle again and again and again, the muscle itself becomes smaller over time, something called atrophy. When your skin does become saggy and your eyelids droop as well, what have you got to pull them back up? Absolutely nothing, because you've Botoxed that muscle so much, you can't hold it up anymore. Whereas if you did the opposite, instead of making the muscle weaker, if you made the skin quality better and tighter and stronger, you're not going to even get those fitted eyelids, well, not, at least not to the same extent as you age anyway.
You could do both together, though. For example, like you could still Botox maybe like twice a year or something like that.
Yeah.
Like on an every 4 to 6 week basis, do something to kind of stimulate collagen.
Yeah, I mean, what you could do is if someone does want an instant improvement or as instant as possible, yeah, you could do Botox for sure. Yeah. And then, you know, slowly, you know, at least offer to them, wean them off something that weakens the skin and everything and the muscle onto something that makes it stronger and tighter and firmer over time, to the point where they actually don't want the Botox anymore because they don't even need it. There are no lines for them to treat, and they just keep staying as they are. And the good thing with that is when you have Botox, yes, you might get rid of a line, but frankly, everyone knows you've had something done because you can't move. Yeah. If you can get rid of a line and prevent the aging process to an extent by making the skin stronger over time instead of weaker, and you still have all your movement, no one can even tell you've had anything done. They just think you just have great skin because you've got no lines, but you still have all your movement. So they don't even suspect you've had anything done.
Yeah, they just think
good. Exactly. I think there's a lot of benefits to giving patients a long-term viewpoint, list of consequences and treatment plan, rather than just, you know, giving them what they want short-term, which if they want that, that's fine. But I think it's good we have to offer them the consequences long-term as well.
Yeah, absolutely. And very often, I mean, you choose not to inject someone if you feel like they're going to benefit from, let's say, skincare to begin with, because they haven't got that. And that's what it's really about. It's looking at the overall picture.
Yeah.
Also just really, really short.
Yeah, I mean, even this morning, actually, I had someone who came in for Botox. I saw her first time in August. She came in today for basically some more. And before I injected her, before I even took consent, I said to her, look, I'm happy to do this for you, but I want you to realize that, you know, ethically, I can't keep doing something without at least telling you what the long-term consequences are. And I said to her, this is what's going to happen if you keep doing it again and again and again.
Yeah.
So no wonder you're getting lines appearing at rest, even though you've had so much Botox.
Yeah.
And I said to her, you know, you want to look at something that improves skin quality, not just freezes the muscle, because if your skin is really good, you're not going to get lines anyway.
Yeah, exactly.
So I mentioned to her skincare, microneedling, mesotherapy, mesothreads, all this kind of thing. So she's gone away with a lot of options, and she's going to do her research, and then come back with, and hopefully choose something different next time.
Yeah, but that's ultimately what we want to achieve. We want to get the best possible result for that person. That's ultimately why they're coming to see us. They want to look as good as they can.
Exactly. I think that's a good point, because it depends on which clinician you go to, whether you get that or not. If you know, someone that you go to isn't medically qualified and don't understand the anatomy, for example, the hypertrophy and atrophic changes of, say, fat compartments in the face, you're not going to learn that in a level 3 beauty qualification. You're going to learn that if you've done a medical degree or a dental degree or a pharmacology degree, and you've done plenty of training. So when you understand things on a different level like that, you're able to predict the long-term consequences. And because you're qualified in so many different treatment types, you have so many different options to reverse that as well. Whereas if you only know how to put a needle in someone's face and put a plunger and push a plunger down, you're never going to be able to A, predict those things, and B, prevent them from occurring in terms of the long-term outcome. Yeah,
you're quite right. Absolutely. So typically, we get a lot of people coming in that want to treat the eye area. That tends to be the number one, as well as the lower part of the face.
Yeah.
What type of treatment options do we have available for the eye areas?
So there's quite a few options.
Yeah.
There's quite a few things. And the important thing to remember is, first of all, the skin around the eyes is the thinnest part of the face. So whatever you do, the mistake's going to show up very, very clearly. Whether you go to me or anyone else, that isn't going to change. The skin is the way it is. So a lot of people immediately ask for filler, which is fine. If they're appropriate for that, then we can do that for them. But again, there is the risk of mistakes showing up easier. And even if it looks perfect on day one, as we age and the fat around that moves and it potentially goes down, something called pseudotosis or pseudoherniation, that can give rise to side effects that we don't get on day one as well. So you have to be prepared for that. But that's just the volume. A lot of people complain about darkness around the eye, dark circles and things like that. That has to do, the darkness is coming from pigmentation, melanin in the skin. So you can basically reduce the activity of melanin production in the skin using certain methods, using certain types of, say, mesotherapy, where you essentially put active ingredients directly next to the cells that are producing that melanin to try and stop them doing so. And then you can put other ingredients in there to help increase blood flow to that area as well, a lot of things like that. And then you can increase skin quality too. So a combination of things can be done. The volume increase with the filler, the increase in skin quality with certain types of threads or mesotherapy, certain cellular changes which you can control by putting certain ingredients into that area. Sometimes, you know, the area here is wrinkly because everything on the side is sagging as well. So you can lift this area up to alleviate the pressure on this. So there's a lot of different things that can be done, but it must be remembered that, one, because the skin is so thin, that mistakes can show up easier, regardless of who's doing it. That cannot be avoided. Number two, it's not something that can be treated absolutely instantly, because if you're talking about changes that have come as a result of cells acting in certain ways, you can't destroy all your cells and create new ones instantly. No, so it takes time, and patience is needed. And whatever we do clinically, professionally, the best result is always going to come if you combine that with good skincare at home as well.
Yeah, it's important to obviously do that. Is there a way to prevent these types of things happening in the skin? Like, say someone's got, I don't know, eye bags. I mean, there's different obviously causes for that, but is there a way that somebody could prevent that from happening?
Depends on the individual person. Some things can, some things can't. For example, one thing that can't be prevented is the fact that our skeleton wears away as we age. It's one of the reasons teeth become crowded as we age as well. And the reason I mention this is because the orbit, the area where the eyeball sits in. When we're young, it might be circular shape, like a pair of binoculars. When we're older, it's almost triangular, like a pair of aviator sunglasses. When you lose some of that bone underneath, the fat that bone is keeping in place now can move because its support has gone. If that fat slides forward, something we call it a pseudoherniation or pseudotosis, that is a true eye bag. That's something which will become visible. You can't stop your bone from withering away. So that you can't prevent. But in terms of the skin quality, yeah, things like that you can prevent, because you want to make sure you start early with A, some protection, and B, good active ingredients to make sure that the cells are nourished as well as possible. And then you'll do your best to prevent skin quality going down as well.
Yeah. And there are just times where, I mean, we do a lot of non-invasive treatments, but there are times where surgery pretty much is the only option that's going to get you the result that you're looking for. So it's about obviously being honest with that patient and telling them.
Yeah, of course. Yeah, I mean, there's only so much you can do non-surgically. Yeah. And when your skin is so lax that even radiofrequency, microneedling, mesotherapy, thread, all these things put together can't do it, that's when really you need to be honest with the patient and say, look, you need to see a plastic surgeon. In the eye region, you're looking at something like blepharoplasty, or you carry out something called an arcus marginalis release to reposition the bag and things like that. Yeah. At that point, yes, definitely surgery is the way to go. And if you have a lot of boxes unticked, skin quality, volume loss, eye bag, bone wearing away, when you got all those things, you need, for a drastic result, you need a drastic treatment as well.
Yeah, and then once you've got that result, you can maintain it quite easily with non-invasive options.
Yeah, things like skincare, and things like just light therapy now and again, things like maintaining collagen with things like microneedling, or some kind of mesotherapy, things like that. And they will always complement the things you do surgically. Surgical interventions are always improved in terms of the result by good home care, such as, say, sun protection. So you always want a combination of things if possible.
But it's like anything, face or body. It doesn't matter if you're getting surgery. It's what you essentially do outside the treatment that's going to maintain the result.
Yeah, it's like going to the dentist. You can see the hygienist for a scale and polish and get your teeth nice and clean. Yeah. But then if you stop brushing your teeth for the next 6 months, it doesn't matter how good a job the hygienist has done, your teeth are still going to go rotten. Yeah. So you always need to make sure that you look after yourself at home to complement what's done professionally as well.
Yeah, you're quite right. I think that's all we've got time for right now. We're going to come back on and do another live later on.
Yeah, probably about 6 o'clock, right, roughly?
Yeah, about 6 o'clock. And we'll chat you through a couple other little things. So we'll talk to you guys later.
See you later. Bye.